good evening everyone. I'm Aditi Lamba. Welcome to Vision of Asia, our daily South Asian news segment, bringing to you all prime news and updates impacting South Asian American community. Currently hosting the show in our Long Island City studio in New York, we are closely following up with national updates on the ongoing crisis of the coronavirus pandemic. This is an ITV Gold exclusive Vision of Asia edition on Coronavirus Pandemic 2020. All updates and info and latest news on the ongoing situation across the world impacting the United States majorly, here especially in areas such as our headquarters, New York City, California, New Jersey, Massachusetts, and many other cities and states. The United States and European nations are currently stepping up measures to tackle the spread of coronavirus and its counteract its economy impact, as well as the numbers of deaths and infections continue to grow. The White House is pitching $1 trillion as COVID-19 coronavirus response package, awaiting the decision from the Congress. Millions across the world, including in the United States, are currently under a lockdown. The White House has advised people not to gather in groups of more than 10. While we're discussing this, New York City is currently contemplating a shelter-in-place order. The New York City's Mayor Bill de Blasio today said residents should prepare for a possible shelter-in-place order within the next 48 hours, following a similar order in San Francisco due to the Wuhan coronavirus outbreak. A shelter-in-place order, typically used in cases of natural disasters such as hurricanes, forbids residents from leaving home except to meet essential needs such as buying food. For all our viewers, we record the Vision of Asia episode a little bit before 8 p.m. Eastern when it airs and you all get to watch it. It may happen so that by the time today this episode is airing on ITV Gold, there could be further updates on the curfew or shelter-in-place already active in New York City. That is 8 million New Yorkers, including all of us at ITV Gold. So we urge all viewers to stay safe and healthy and follow any instructions of your local and state government's efforts. And do keep up with changes as well as updates consistently. Let's now take a look at the headlines for tonight on our daily South Asian news segment, Exclusive Coronavirus Pandemic. Here are the headlines. Consul General Sandeep Chakravorty addresses South Asian Americans, COVID-19, Consulate General of India, New York. Dr. Tushar Patel advises on COVID-19 updates, prevention and resources, Skype interview at the ITV Gold studio. How will COVID-19 impact our lives? Panel discussion featuring top medical and business leaders, ITV Gold exclusive. Stay with us, we'll be right back. Stay tuned watching Vision of Asia. Welcome back, I'm Aditi Lamba and you're watching Vision of Asia special edition on the coronavirus pandemic that has hit our nation and more than 100 countries across the globe. At least 100 people have died from the novel coronavirus across the United States, and there are over 5,300 cases of the novel coronavirus in the US, according to the state and local health agencies, governments, and the US Centers for Disease Control and Prevention. Secretary of Defense Mark Esper said today that the Defense Department will make 5 million N95 masks available to the United States Department of Health and Human Services for distribution. As the situation gets intense with many states going into curfew, with New York City told to prepare for shelter-in-place and lots of chaos and concerns regarding COVID-19 and the extent to which it can halt America can truly create public safety hazard. More than 1,500 Air and Army National Guard members are now supporting the response to the coronavirus pandemic across 22 states. 37 states in the US have now closed their public schools. Here is an informative panel discussion featuring top South Asian medical and business leaders on the topic, how can the coronavirus impact our lives, featuring Dr. Hitul Gaur, Dr. Pradeep Shah, Ashok Oja, Dr. Pooja Shah and Dr. Tushar Patel. They covered various do's and don'ts. Let's take a look.
How serious is this issue of coronavirus?
The magnitude of this disease is tremendous. We have not seen this in our lifetime. In our area, in tri-state area, we have 11, in New York and New Jersey. New York, we had 39 cases, New Jersey, 29 cases. And in the United States, we have more than 1,100 cases. So this is a very serious matter. However, my first message to the community is be prepared don't panic. Use common sense. That is the first message I would like to give.
तो डॉक्टर प्रदीप शाह, मैं जानना चाहता हूं कि ये इन्फेक्शस डिजीज के मामले में ये किस तरह से काम करता है, किस तरह से इंसान को अटैक करता है, उससे हमें कैसे, क्या प्रैक्टिकल में, व्यवहारिक जीवन में कैसे उसको हमें संभालना चाहिए, कैसे अपने को बचाना चाहिए?
Okay, I would like to give you some little perspective about the coronavirus before we go into COVID-19. Coronavirus is a common cold virus, which every now and then in the winter we get it, and most commonly we get it. And this coronavirus, which is already there, I'm not talking about COVID-19, but I'm talking about the normal coronavirus, which usually affect your sinus or upper respiratory tract infection, meaning the nose and the throat. And it's very common, and it goes away within the 3 to 5 days, and you don't have to worry. At the most you get it is what's called the sinus infection complication. But the COVID-19, which is a different virus, what has happened, it's a coronavirus, but it had mutated, and it started in December in the Wuhan county or province in the China, where there is a wet market, it is called. Wet market is where the animal, live animal and dead animal has been sold in that market. And somehow this has been transmitted from animal into the human being. And that's how it started. Initially, nobody knew what virus it is, but it has become now what is called the pandemic. Pandemic is the word used, which is affected all over the world in this. And as Dr. Tushar Patel said that 121,000, which is diagnosed, and undiagnosed, we still don't know how many of them. And about 4,000 people died. So the death rate in this is about 2% so far in China. In the other country, we cannot calculate a death rate because we don't have still proper the numerical and the denominator to find out how many people will be dying or what is the percentage. But having said that, what is the peculiarity of this virus that we need to all know? COVID-19 is a coronavirus. It's different than the regular coronavirus. Also, how does it? It lives on the solid surface of your any part of your home or the anywhere you are. It's not on any porous surface also it can say, but the problem is this can live up to 3-4 days. We don't know. First of all, I want to tell you, we still don't know about the coronavirus much of COVID-19. It's a very preliminary phase, and we don't know.
Of course, many events are being cancelled. So many activities which I'm involved in, I had to cancel it for the program. Now, to maintain the day-to-day life, should we go to mall for shopping? Should we buy groceries? Should we invite people or visit friends?
The key thing here is, there's a lot of panic in the public. The main thing is hand washing. As long as you hand wash and you take care of yourself, that's the most important thing, especially if you want to go to the mall, you want to visit friends. The main thing is majority of the healthy individuals, if they contract coronavirus, most of them have mild symptoms. There are rare cases where it could be more severe. But the concern is you just have to keep hand washing. If you have to cough and sneeze, do it away from everybody. Don't be close to anyone. The main concern is passing the virus to elderly people because they're at high risk. People who have comorbidities, underlying diseases, especially like COPD or asthma, are at high risk, and immunocompromised patient. So if you know as an individual you might come across those kind of risk factor patients, then it's important to wash your hands. Make sure if you feel sick, don't go near them. Try to avoid. But just take caution. That's the main thing. You have to take the precautionary of everyday life.
How is the businesses in our Indian American community is behaving? This situation has, of course, created like some kind of maybe false alarm that things are not coming from India and things are in short supply, so the prices are going up. So please discuss that.
There is no reason for any unnecessary panic or fear at this time. Actually, the government, ready.gov, has already told everyone, it's on their website 24/7, 365, that you should be ready for 2 weeks supply no matter what. There is no reason for anyone to stock up the alcohol-based hand rubs and those things. You can wash your hands with soap and water.
Okay.
So one other thing I would like to mention here, that America is and our community is very resilient. We help each other in the time of need. This is no different than your floods or tornadoes or natural disasters. Help each other. If the elderly need some medication for 2 weeks, help them so they don't need to go out and get the medications. And I think we need to be prepared in order to fight this together. There is no medical community and government can't do this alone. All people needs to be part of this and ensure that we do our own part.
We had a follow-up with Dr. Tushar Patel with much on the ongoings regarding COVID-19 and its current updates that all Americans should be aware about. Via Skype, Dr. Tushar Patel joined us from New Jersey with lots of important information on the outbreak of the coronavirus, covering various aspects of this health crisis in the world and his comments on the essential need of social distancing. As we all know, New York City currently might be getting a shelter-in-place enacted as we speak right now. Here is Dr. Tushar Patel, a leading medical professional, president of the Indian Health Camp of New Jersey, and the chairperson for Gopio International, global organization of people of Indian origin. A very informative interview. Let's take a look at this segment reflecting upon the details on the spread of the coronavirus, chaos in the community over health safety, and most important, preventative measures for all to take, and a word of advice. Let's take a look. As a medical professional right now, what are those key factors that have been missing and things that have the doctors worry in case of the coronavirus right now? Your take on that?
So currently, the state government, local government, and the federal government is responding to COVID-19 situation. It's a public health emergency. Even WHO declared a pandemic last week. So the best thing right now is to ensure we follow the local, the state, and the federal government recommendations of staying home. If you are sick, stay home. If you are non-essential personnel, stay home if you don't have to go to work. If you have a telework schedule, or if you can work from home, or if you have availability of flexible work, you ensure that you follow that recommendation given by the local and the state and the federal government.
Doctor, were you anticipating this kind of an impact? We're talking about several states shutting down high schools and universities. We're talking about, a potential lockdown in certain epicenters. Your take on that, were you expecting this as a medical professional?
No, I was not expecting this much, but I think this is a wise thing to do. It's a little delayed, but I think it's a wise thing to do because the containment, the isolation, the quarantine, these are the big steps we need to take at this point to ensure that we can stop the spread of the coronavirus COVID-19 in the state and in the country.
A quick insight into age breakdowns and perhaps, the age groups, especially from the South Asian diaspora, the people that should really watch out for symptoms and their health.
So the most common age vulnerable to this is age 60 and over. The second group is people with chronic medical conditions, heart disease, lung disease, kidney disease, diabetes, people who are immunocompromised, patients who are taking cancer treatment, pregnant female. All those people are at high risk of catching disease. South Asian, we have a lot of people who has comorbid conditions, diabetes, hypertension, cardiovascular disease, kidney disease. So they are at risk of catching this disease. The best thing for them to stay home, avoid close contacts with people who are sick, avoid touching eyes, nose, face, and mouth, and wash hands frequently.
Your take on how it's impacting our everyday life right now in America?
So the best thing right now is social distancing is most important and effective, which is strategy in reducing the spread of COVID-19. It means reduce close contact between people to slow the spread of infections. Social distancing measures including limiting large groups of people coming together, closing buildings and canceling the events. If
Right.
you are home, the
Yes.
best thing is if you have adult home, father, grandfather who are old age, don't try to give them the virus if you are outside. So to ensure that the older age population is safe, make sure they are isolated, not necessarily they're isolated in the room,
Right.
but avoid close contact with those individuals, because the young people can carry the virus and give it to the older age or the susceptible individuals
Right.
who has medical conditions or who are in that risk age group.
Doctor, we keep on hearing that you should maintain a 6 feet distance between you and a person, or perhaps the 3 to 6 feet. Your suggestion on, if you're living in a household and currently with school shut down, nation on halfway of a lockdown, what do you recommend in that, in spacing from family members amongst, and also, you know, we're here in the studio, we're still working, suggestions on that?
So the best thing, if your household, if you have seniors, the grandparents are home,
Right.
ensure that they don't come into close contact. Means they don't hug, they don't shake hands, they don't share items. I think those are the common sense approach you need to take. You can carry on with daily life if you are not sick. If you are sick, you want to ensure that whoever is sick is isolated or in for 2 weeks, or contact their primary care physician
Right.
if they fall into the category of getting the testing based on the history and physical examination.
Your take on how much should we worry about our children's health and well-being, and also their mental health care, with so much happening around them at this time?
So children and young adults are mostly safe from getting COVID-19. And even if they get ill, the symptoms are very mild. Younger age group, especially healthy individuals without any underlying medical conditions, are not at much risk. However, like I said before, they can bring the virus home and infect their elderly parents or grandparents, which is the most concern right now.
Right. In your latest stats that you may have received, Doctor, are we still seeing the highest number of deaths in the older age groups, as it's been reported by many media outlets?
Mostly deaths are, like I mentioned, is the older age and people with chronic comorbid medical conditions. Haven't seen many cases where the young healthy individuals died for COVID-19.
You know, Doctor, while we are discussing COVID-19 here, I think the biggest concern we keep on seeing across spectrum is the fact that, you know, there's not enough testing available right now for everybody. And also, it is really difficult to determine who has the virus and who doesn't, who's carrying it or who doesn't. Your take on trying to detect this virus, and how we should all sort of contribute to making sure that we are healthy and we are ensuring that?
So currently in the United States, not everyone is encouraged to go for a test. So if somebody is feeling sick, if somebody is falling into the category of coming from a country where they came across with COVID-19, the best thing to call or discuss with their primary care provider and have the symptom screening and provide the accurate history to the physician or the healthcare provider. If they return from COVID-19 infected countries. If they fall into category of high risk for an exposure, the primary care physician or the hospital can order the test for you. But there are no currently test centers where someone can go and self getting that test of COVID-19. So that is not recommended by CDC, that is not recommended by the federal government, that is not recommended by anyone right now in the US. Unlike other countries, few other countries have the self ordering the testing. They can go at the test center and get the testing done. In the US, that is not the case.
It's time for another short break. Stay with us on Vision of Asia. Coronavirus pandemic. We'll be right back. Welcome again. You are watching the Tuesday night edition of Vision of Asia Coronavirus Pandemic Focus. As the world grapples with coronavirus, we are looking at many strict measures both in the US and back home in South Asia, especially in India. Again, we hope you all are staying safe and healthy, especially the ones here residing with us in New York City and others in hotspots for COVID-19. Now, addressing all major concerns and chaos, we have a part of our exclusive conversation with Consul General of India, New York, Sandeep Chakravorty from our ITV Go studio in New York City. With thousands of concerned Indian Americans reaching out to the consulate as well as our network, the Consul General addressed various factors regarding COVID-19 and its global impact, answering all questions on the travel advisories, quarantines, testings and updates in both India and the United States. Consul General Sandeep Chakravorty is the member of Indian Foreign Services IFS since 1996 and is one of the strongest representation of the Indian government and is tied with community here in the US. Let's take a look, and again, do take all measures and contact the helplines of the Consulate General of India, New York for any questions, or you may also reach them via their email. Visit www.indiainnewyork.gov.in for more information. Here is Consul General Sandeep Chakravorty. Plus, welcome on the show again, Sandeep Chakravorty. Thank you so much for joining us, sir.
Namaskar. Happy to be on this show.
Sir, I wish I was having you here in better circumstances, but I'm really glad that you've agreed to come to our studio today. This entire week has stunned many people and definitely has impacted everyday lives of not just Americans or Indian Americans, but Indians back home. And when we're looking at this entire situation, it's very confusing and it's evolving right now. So my question to you first would be, how has this impacted you personally and your experience so far, and how is the consulate handling all of these changes that keep on happening on a daily basis?
Well, thank you, Aditi. I'm happy to be on this show, and I think it's a very good idea to hold this show now because you see, we Indians who live in the United States, we are affected doubly.
Right.
Because of the situation back home in India and also the evolving situation in the United States where we are living. So my first request to all your viewers is that please take adequate precautions. First, here where you are living in the United States.
Right.
Today we saw the advisory which the White House has released. We have seen what is happening in New York. We have seen what is happening in New Jersey.
Yeah.
So I think it's very important that we all remain very safe. And also I know we are concerned about the situation in India, but I think what is very reassuring is the steps the government of India is taking.
Yes.
To control the situation.
Yes.
And we started quite early. I think in January we were one of the first countries to impose the travel ban on people who
Right.
had traveled to China. And last week we imposed the travel ban on all travel. And today we have a new advisory which says that we will not allow any passengers from Europe. So I think our government has been very proactive. It is
Right.
taking the right steps.
Yeah.
And the whole ambition or the goal is to make sure that because of transmission, the curve doesn't go up, it flattens out.
Right.
And we delay its expansion and we combat it.
Currently, what are some of the biggest concerns of the Indian government in looking at COVID-19 right now? And also, when you're looking at Indians that are living in India, how do you see that how do you see their daily lives get impacted by this?
You see, I think the government of India is aware that
Yes.
because of the population and the proximity in which we live, COVID can expand quickly.
Right.
But I think we have taken many measures. First one was one point we need to keep in mind is that as so far we do not have community and society spread
Right.
in India. Our cases are mostly due to travel, and we have been able to trace the travel. In up to 4,000 contacts we have traced people who traveled from either the Middle East or Italy.
Right.
And we have been able to isolate those cases, and we have been able to put those people in quarantine. We have developed quarantine facilities.
Right.
I have some figures here. We have been screening. We have screened in the last several days 1.2 million passengers.
Wow.
Who arrived in India at 30 airports on 11,406 flights. and we have even traced 4,000 contacts of those people who are carriers, potential carriers, and the numbers of cases so far has been 84. And I think given the Indian size of the Indian population, I think it is a remarkably low number. But you see, we are what is the situation currently and the data that we have, they don't match. The COVID is ahead of us. So in the coming days there may be an expansion, but the whole idea is to control the expansion, to isolate people, not to have social too much of social contact. Social distancing is important, and government today announced several measures, including closure of schools and other measures. I think all these measures will have its effect, and India has been good in combating these kind of epidemics and pandemics. A few years back we had the Nipah virus in Kerala, and our health system is geared to tackle these kind of cases, and I'm confident that we will be able to manage the epidemic. But what I want to ask our viewers is that don't panic. We have to combat the situation jointly. Some of you may have been inconvenienced by the travel ban, but we have to understand that this is for your benefit, for your health, health of your family members, because as Mayor said yesterday, every one of us is a potential carrier of the virus. We may not show it, we may be asymptomatic, but we can be potential carriers, and why subject people to risk? So as far as possible, don't make trips or don't make non-essential travel. Try to keep your social interactions to the minimum, and I'm sure with all this we will be able to combat the situation.
I would definitely love to go more into the travel restrictions and the advisories, because we've had so many questions, and for everyone watching us, the Indian Consulate was working throughout this past weekend because of these concerns and calls, so we'll definitely be addressing it. Again, we are going live on ITV Gold. Call us with your questions. And that is all for our show for the night. Remember to send us your suggestions, give your voices and organizations on our show, email us on events@itvgold.com, or follow us on our Facebook handle @ITVGold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight, and again, please stay safe and healthy. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.